1 out of 5 women in India suffer from polycystic ovary syndrome. PCOS affects millions of women of reproductive age in India and is the leading cause of infertility. Hi, I'm Sania Mirza, and I take privilege to welcome Dr. Vaishali, a renowned health expert who will offer practical strategies to empower women in managing PCOS complications. Raising awareness about PCOS can greatly benefit women due to the numerous myths and misconceptions surrounding the condition. Doctor, can you enlighten us on how a balanced portion control meal can positively impact a PCOS patient?
Thank you, Sanya, for asking me this question. Well, a balanced meal is a very important cornerstone of managing a weight and bringing down the PCOS. It's not only the caloric restriction, but also the correct composition of what is being consumed daily. That is very important. A balanced composition, meaning it should have a correct proportion of proteins, carbohydrates, and fats in the meal. Few tips that I will say from my side. First is that a food journal, maintaining a diary where you note down exactly what is being consumed, what was the caloric value, and what were the timings of consumption, will go a long way in helping you planning your meal. Second tip that I would like to suggest is that you should control the portions. Even if you are eating something that may not be the best food, but if you control the portion, it will really help you. And the third important tip is that whenever there is a woman suffering from PCOS, it is also the responsibility of the family to help her by being a part of this meal planning. It's not correct if you are going to binge on outside food and the poor girl is trying to manage her diet. So the families should also participate in this diet planning.
Thanks, doctor. Can you also share how crucial is physical activity in the management of PCOS?
Exercise forms a very important part of the lifestyle modifications that we want to happen for correct treatment of PCOS. It has been found by research that even 150 minutes of physical activity in a week will go a long way in bringing down the weight. It is also important that not only a particular monotonous type of exercise should be prescribed, but the girl can try various types of exercises to bring down the monotony and to keep up the motivation. Even a 5% weight loss can help to bring down the hormonal corrections, and the hormonal imbalance can be cured. Because insulin resistance is a very important problem that is seen in the cases of PCOS. To bring down this insulin resistance, it has been shown that physical activity can really bring down the testosterone levels and improve the insulin resistance, thereby bringing down the problems of acne, hirsutism. All these things can be corrected. So I will advise that along with this girl who's doing the physical activity and trying to lose weight, even a participation with the family members in the running program or accompanying her to the gym will really help this girl to keep the motivation and continue her exercise.
Thanks, doctor. One more question. What are the important parameters to be regularly monitored in PCOS patients?
PCOD is always associated with other allied problems like, for example, diabetes, hypertension, obesity, infertility, repeated miscarriages, and cancers like uterine cancer. So whenever we are dealing with patients of PCOS, we always would like to monitor if these associated complications are likely to happen. So we monitor the fasting blood glucose or the blood glucose levels. We monitor the body mass index. We also monitor whether the lipid profile is normal, and the other treatments and investigations for infertility if she's facing that. Example, whether she's ovulating normally, and if she's pregnant, to find out tests to find out if she has the likelihood of undergoing a miscarriage. These women also are known to face a lot of anxiety and depression because of complications like skin problems, hirsutism, acne, obesity. So these girls are at that tender age facing these problems, and they are likely to have anxiety and depression. So as doctors, we should be vigilant to find out if they are also suffering from these problems and should guide them for having correct therapy. So, whenever a woman becomes pregnant and she has been a patient of PCOD, we have to keep extra vigilance to find out whether she's developing gestational diabetes and her bringing down the chances of miscarriages. Even after her deliveries have happened, the women in 40s who have had PCODs should regularly undergo checkups to find out their lipid profile and unfortunate events, to prevent events like breast cancer and uterine cancer. They should always undergo screening methods.
Doctor, the clear message for all women is that meal, movement and monitoring are pivotal in managing PCOS for the benefit of women and society at large. Thank you, Dr. Vaishali, for your valuable insights which can be vital for effective management of PCOS. As an athlete myself, I recognize the importance of lifestyle management for a healthier tomorrow. Together, we can break the stigma, spread awareness, and support each other in this journey towards better health and well-being.